everyone, Dr. Joanna here with Momenta Chiropractic, and today I'm going to show you a few of the rehab exercises we like to take our patients through that are dealing with IT band syndrome. So IT band syndrome, the underlying cause is typically when the knee is caving in toward the midline when we're going through our sport or activity such as running or squatting. And the reason that that's occurring is often due to gluteal weakness or fatigue. So the muscles in the hips are just not functioning properly. So we will focus on strengthening the muscles around the hip so that we can control the position of the knee better to not cause the compression at the lateral portion of the knee that will produce that pain that's felt with IT band syndrome. Okay, so the first exercise that we're going to cover is side lying abduction. So for this exercise, we're going to start lying on our side. So once you get into that position, you're going to orient your leg so that your top leg is extended, and then your bottom leg is bent and positioned slightly in front of your back leg. So from here, we want both of our toes to be pointing in front of us. And then we're going to lift our leg up toward the ceiling, holding at the top for 3 seconds before we're lowering back down. The objective of this exercise is to activate the glute med muscle, which is responsible for pulling our leg out to the side or doing this lateral abduction. So we want to make sure that's a clean motion by not letting the toes dip downward or rotate inward, or do the opposite where they're rotating up toward the ceiling. So we want to keep the toes oriented forward as we're lifting up, holding for 3 seconds, and lowering back down for each repetition. You should also try to keep your hips stacked on top of each other so they're not rolling forward or rocking backwards as you're going through this motion. Try to keep it nice and clean, foot oriented forward, holding at the top 3 seconds, and back down. So another concept that we're going to cover, and a question that we get asked a lot from patients who are dealing with this IT band syndrome, is whether or not to foam roll that area. And you might see a lot of conflicting information out there if you're doing some of your own personal research as to whether or not it's beneficial to foam roll over the IT band. So what the most recent research is showing us is that foam rolling along the IT band can actually be very beneficial. There's a lot of muscle attachments to the IT band from the quad, as well as the glutes, that can help kind of loosen up some of those restrictions. The only thing you want to avoid when foam rolling is foam rolling directly over the place that is most painful. So as we've talked about, one of the main causes of IT band syndrome is compression of the fat pad that sits right underneath the band. So if we're already compressing that, that area with the sports that we're playing or through exercise, we don't want to further that compression by foam rolling right over the area. So in order to do this correctly, we want to get on our foam roller, orient your foam roller so that you're able to get the lateral portion of your thigh. I like to do this by positioning my top leg slightly in front of the leg that I'm trying to foam roll. And then from here, you're rocking back and forth over the middle portion of your quad. So again, we're not getting too close to the knee and to that fat pad that's like highly innervated and has a lot of pain receptors, because that would not feel comfortable. So with this, you can also rock forward a little bit so that you're hitting a little bit more of the quad attachments onto that fascial plane there. And you can also hit the glutes a little bit more. So we were just working on some glute strengthening, but you can also foam roll over the glutes, which could help reduce some of that pain that we're feeling right over the lateral portion of the knee. All right, so those are a few exercises that we like to prescribe our patients throughout the course of their treatment plan for IT band syndrome. Give them a go. Let us know how they're feeling. Drop any questions that you have in the comments, or feel free to reach out. We love to be a resource for you guys, and we'll catch you later.